A very good evening to all MCC members. Today I am going to present a voice message on the topic gout. Gout. Gout is the primarily a disorder of urine metabolism which results from the excessive accumulation of uric acid in blood or either by impaired excretion of uric acid by kidneys which result in accumulation of monosodium urate monohydrate crystals in tissue like articulate cartilage, synovial joint, pinna, articulate endobones and also in kidneys and subcutaneous tissue. Now, mainly males are more affected than females. Males over the age of 40 and females after menopause or in all ages. And often a familial history are also positive. Now, predisposing factors of gout are hyperuric patients are commonly involved and patient may be alcoholic, obese and hypertensive and the patient may be taken diuretics, thiazides and aspirin. Factors which predispose to chronic gout are diminished renal excretion in case of renal failure, chronic drug therapies by thiazides, loop diuretic and low dose aspirin, pyronesinamide, lead toxicity and lactic acidosis in case of alcohol. And either it will be increased by the production of uric acid like myeloproliferative disorders, polycythemia, chronic lymphatic leukemia and also in glucose 6-phosphate deficiency. Now, common list joint involved are first metatarsal pharyngeal joint and after then ankle of the finger joint. Gout is present as acute attack which is sudden in onset with severe pain which lasts for a week or evolved part become tender and overlying skin become red, shiny and edematous and mainly in this first metatarsal pharyngeal joint involved. Now, the aspirant of the involved joint and demonstration of intracellular monosodium urate crystals is diagnostic, which show a negatively monosodium urate crystals in synovial fluid, which is examined in polarized light. Now, X-ray show a gout tophy, which is the nodular deposition of monosodium urate monohydrate crystals which causes a foreign body reaction and it deposits in lung connective tissue. This tophi may ulcerate the skin or destroy the cartilage or periarticular bone. Now, punched out erosion which appear after the development of clinical tophi showing the sclerotic margin and overhanging edges as shown in this X-ray. Now, the X-ray showing intraosseous lesion and gout preserved joint spaces until the late stage of disease. There is no any periarticular osteopenia which differentiates it from rheumatoid arthritis in which periarticular osteopenia are present. Now come to treatment. In case of acute attacks, the fast-acting drug NSAIDs together with local applications are effective. Oral colchicine, which is a potent inhibitor of microtubule assembly, is effective, but after taking it causes vomiting, severe diarrhea at high doses. So, the low doses of colchicine is recommended. Now, the joint aspirin can give instant relief, but it can combine with intra-articular steroid injection, which prevent it from fluid accumulation. Hyperuricemic drugs like propionic acid, sulfenpyrazone, which can be used if renal functions are normal. And if there is complication in renal function, then allopurinol is used, which is a drug of choice in chronic tophic gout, and it works by inhibition of xanthine oxidase. Now, the dietary management include the restriction of taking high purine diet like seafood and meat, extra weight loss and reduce in alcohol intake are also effective. and the patient who take diuretics, it should be advised to stop. That was all about gout. Hopefully this video will helpful for all of you. Thank you so much.